Good evening, this is News Mongolia. I'm Satlong Hortz in the MNB World studio. Our top stories for today are COVID-19 status in Mongolia. Citizens need to follow all preventive measures to avoid strict lockdown. National Emergency Commission decides not to impose strict lockdown. For other news, stay tuned. The Ministry of Health and the National Center for Communicable Diseases held its daily press briefing and updates on COVID-19 status in Mongolia.
206 new COVID-19 cases have been confirmed in the past 24 hours after 12,326 people were tested nationwide, and the country's total number of cases has reached 5,392. 152 new patients have recovered, and the total number of recoveries is now 3,758, making up 69.7% of total cases. All new cases but 2 were confirmed domestically, making the number of total domestic cases 4,652. 191 cases out of the new cases were confirmed in Ulaanbaatar, making the Ulaanbaatar's total number of cases 4,474. And 13 rural cases were recorded in Hufsut Province, 1 of 2, Darkhangol 7, and 3 cases in Tuv Province. The 206 new cases include 2 medical personnel who have been treating the infected people. Out of the 1,419 patients who are currently undergoing treatment, 4 are in critical condition. Health officials warn the public to take precautionary measures thoroughly as the number of infections is increasing over the days. Ulaanbaatar city has entirely become an epicenter of COVID-19, so there is no place in the city which has less risk of getting exposed to the virus.
The Prime Minister of Mongolia, Oyun held his weekly meeting with the Immunization Working Group headed by the Minister of Finance. The meeting covered updates on immunization campaign, vaccine procurement, the current supply of vaccines, and proposals from private companies to take part in the campaign.
The meeting was also attended by the Deputy Prime Minister, Minister of Health, Minister of Foreign Affairs and other officials. To date, a total of 474,000 doses of 3 different vaccines have been imported to Mongolia: AstraZeneca from South Korea and India, Verocell from China Sinopharm, and Sputnik V from Russia. So far, 209,274 individual doses have already been administered. According to a survey of people who have been vaccinated, more than 40% had a normal immune response, such as a slight fever, and no serious complications or side effects have been recorded. Mongolia's immunization rate ranks second among countries in the Asia-Pacific region and 17th out of 146 countries in the world that have been administering COVID-19 vaccines, twice the global average of 6.2%. Currently, 13 vaccines have been introduced worldwide. 103 days after the launch of the world's first COVID-19 immunization campaign, 20 days after the launch of the COVAX program, and 27 days after the first shot was administered in Ulaanbaatar, Mongolia has managed to vaccinate an average of 15 to 20,000 people a day. Second doses will be given 28 to 56 days apart, and it is estimated that 1 million people in Ulaanbaatar will be vaccinated by June 1st. Immunization is being carried out in 8 stages. Emergency response teams, workers in strategically important sectors, trade and hospitality sector employees, education sector workers, people aged 50 to 64 and people living with disabilities, seniors who are above 65 years old and organ transplant recipients, adults aged 18 to 25 years old, and adults aged 25 to 49 years old. Starting this week, the COVAX program will deliver 25,000 doses of the Pfizer vaccine, which will be allocated for seniors who are 65 years old and up and organ transplant recipients. Vaccine procurement proposals have been submitted to neighboring countries and negotiations are ongoing. An AstraZeneca vaccine purchase is being negotiated with India. Minister of Finance Jauhlang stated that there will be no delays in financing the procurement of additional vaccines.
On Monday, the National Emergency Commission met to discuss the ongoing status of COVID-19 in Mongolia and whether to impose a lockdown in Ulaanbaatar. The Commission decided to extend the current orange level regulations for the state of emergency until April 5th, instead of imposing a strict lockdown in the capital.
On Monday, Mongolia recorded 210 new cases of COVID-19, the highest number of new cases recorded in 24 hours. Regarding the increasing number of COVID-19 cases, the National Emergency Commission met on Monday evening to discuss further measures to be taken.
The National Emergency Commission has decided not to impose a strict lockdown and instead to extend the current third-level orange regulation for another 2 weeks. During that time, services and business will operate under required precautionary measures and some modified regulations. Related instructions on preventing possible risks will be given to the public and entity. As you know, the National Emergency Commission, along with the government, are aspiring to reduce the number of COVID-19 cases without imposing lockdowns, but by improving management and strategies. The decision was scheduled to be introduced during the cabinet session on Tuesday. Even though COVID-19 cases are increasing, as we have prepared more mobile testing centers and treatment centers, we have decided not to put the city under a strict lockdown.
The head of the National Emergency Commission then answered questions from reporters. During the question and answer session, it was announced that although strict citywide lockdown measures will not be taken, partial regulations and lockdowns will continue in areas with high-risk active clusters. There are now 1,000 beds available for COVID-19 patients, and in order to focus more on patients with severe symptoms, asymptomatic patients and those with mild symptoms will be allowed to stay isolated at home. If a patient refuses to stay isolated at home, they will be treated at a quarantine center. Amr Sahang also addressed rumors and speculations being shared among the public. He stated that the immunization campaign is being carried out as planned. As of now, 223,000 people have had their first dose of a COVID-19 vaccine, and there are doses for 240,000 people left. More vaccines will be received in the coming weeks, and the campaign is expected to run smoothly in the future. The National Emergency Commission said that it will work on better informing residents of an area in which a partial lockdown will be imposed, ideally notifying them 24 hours prior to the lockdown and being more transparent with information. According to Health Minister Ingbolt, the number of COVID-19 cases in Mongolia would have reached 4,000 to 5,000 if 3 strict lockdowns hadn't been imposed. He highlighted that the recent partial lockdowns in the 26th Hora of Bainzorg district and the 15th Hora of Hangol district were also necessary, as the regions are highly populated and have seen many numbers of COVID-19 cases in the past 3 months. Also, the one-door, one-test campaign was determined to have been effective, as 36 unknown clusters and 219 cases were discovered. Officials say thanks to the one-door, one-test program, preparations for the ongoing immunization campaign were well organized.
Now let's take a look at the currency exchange rates from the Bank of Mongolia. Here is the weather forecast for the world's major cities. That's all we have for today. Thank you for watching News Mongolia. We'll see you tomorrow with more news and updates. Have a nice evening. Goodbye.